Hello again. We are back, and I'm Dr. Amy Novotny, and we're going to talk about headaches today and how they can be related to how you hold your body. This can also apply to migraines as well. Some people have migraines, auras, visual disturbances, all because of how they hold themselves and what they thought was correct posture, but wasn't exactly correct posture and wasn't serving them. So, from very little, we're often taught a kind of Superman military posture. Chest out, shoulders back, suck up that gut. And some people do it really well and take it to a very far extreme and never let their body relax. Now, there is a difference between slouching and slumped over and forcefully sitting back or holding ourselves back. We would like to get into neutral, kind of neutral in between those two, where the body knows how to relax but is still upright. Often what happens with a variety of headaches, especially in the forehead, the temples, behind the eyes, in the occipital area in the back of the head, a lot of the tension that we create in our torso can then refer up into our head and create a lot of tender muscles throughout our head. What we want to think about is, instead of lifting up our chest, pulling our shoulders back, and sucking our gut in, is we want to do almost a reverse of that, where we let the chest drop in, ribs drop down. Yep, let those shoulders drop down, so our rib cage becomes back into a neutral position like a cylinder. If we are lifting our chest up and pulling our shoulders back, we're tipping the front of the rib cage up. It adds a lot of stress and tension along the sides of our neck. Our upper traps start to kick in, and you can feel it. You can feel how when you lift your rib cage up and pull the shoulders back, the upper trap muscles here on top start to kick in and become tense. The neck muscles start to kick in as well, and now the position of our head gets off kilter because our rib cage is not down in that neutral position for our head to sit over. So it starts to adjust as soon as we lift that rib cage up and arch our back and try to flatten our upper back. Our head now starts to get extra tension and strain to it because the muscles are now not in the normal position that they're supposed to work in. They start to get off position, and then it starts to affect the jaw. The muscles underneath the jawline start to get affected, as well as our temporal muscles, and it goes all the way into our forehead and all throughout our skull. And this becomes a problem, especially if you're used to standing for a long time or sitting for a long time and you're holding yourself in this rigid posture. Our bodies are supposed to move. They're supposed to be fluid. They're supposed to relax. They're supposed to let go. They can be at attention, but not for long periods of time. And definitely every day you want to make sure that you're releasing all the muscles that you use to guard your body during the daytime. If possible, sit in the back of your chair, let the chair back, relax your body, let it support your body so that the rib cage can drop down, creating space for your neck, and allow your head to go back into its neutral position so it stops pulling through the skull. We want to get rid of the ways that we hold ourselves as a factor in headaches. There's obviously other reasons why we have headaches, but these are the position, how you hold yourself is a huge reason why we can have tension headaches and even some migraines. So if you have headaches, if you have migraines, please at least consider this and look at this as a possibility. Look at yourself in the mirror or have someone take pictures of you from the side, the front, and the back, and you can look at yourself and see, do you look relaxed? Are you allowing your rib cage to relax down? Are you going the opposite and you're too far slumped forward? Sometimes that's the case, but often we pull ourselves back too much. There's many ways where we hold ourselves that really can contribute to our headaches and migraines. If you have questions about this, reach out to me, amy@PABRinstitute.com, PABR Institute.com. Have a great one, and we'll see you next time. Bye.